Good afternoon, everybody. I'm Doug McGowen with the City of Memphis, here representing the joint Memphis and Shelby County Task Force. I'm joined today by Dr. Taylor from the Shelby County Health Department. I'm going to start with a bit of an update on vaccines here locally, and I'll talk about our door-to-door campaign and what we're doing to get people out to get vaccinated. I'll turn it over to Dr. Taylor to give us an update, and then, as usual, take questions. So a bit of a good news and bad news story with respect to vaccines today. We've given 893,000 vaccinations here in Shelby County. That's about 52% of the population has received one dose. That's 487,000 people with one dose. And just about 400,000 people have been fully vaccinated. We're about just right around 42% of the population fully vaccinated. So that is good. We are not where we want to be, and certainly we want to continue to march forward. Now, in earlier conferences, I had talked to you about our vaccine supply, and you'll recall early in the pandemic, we had several instances where vials were broken and doses were wasted. Well, unfortunately, because of lack of local demand, and despite our best efforts, on September 21st, we had to return 3,000 doses to the state of Tennessee. That was the Johnson & Johnson vaccine, because those 3,000 doses had reached their expiration date. Now, I want to give a bit of context. These were doses that were shipped to us at the beginning of April, on April 5th to be exact, as a part of a 21,000 dose shipment. And you'll recall that on or around the 13th of April, the CDC halted administration of the Johnson & Johnson vaccine. About 10 days later, they began again giving us the authorization to do those vaccine administration, but there was some hesitancy in the community, and we've seen that lingering. We have, since that time, offered the Johnson & Johnson vaccine at every community drive-through site, at every community-based pod, and now there have been more than 100 community pop-up pods, at all of our homebound and homeless efforts that we have underway, and we've given more than 12,000 vaccines in that campaign. And we have also taken efforts to transfer Johnson & Johnson to other municipalities, other agencies, both public and private, who requested it, including a transfer of up to 7,500 doses to North Carolina just last month, and shipments to both Fayette, Tipton County, and within Shelby County. We've been in constant dialogue with the state since we received these doses and we saw the low uptake. We asked if there was a potential for the expiration date to be extended, and there was none forthcoming. And so we have known this day was coming for quite some time. We have done everything we can to get people to take the vaccination. And unfortunately, because of that lack of demand, those 3,000 doses had to be returned to the state and are expired. Now, there have been stories in the national news and local news about what they're calling wasted vaccines. I want to assure you that to this point, the Memphis Fire Department and our partnership through public vaccinations have delivered more than 300,040 vaccines. So right about 1% of those doses haven't been able to be administered, including these 3,000. And along the way, there are another 500 that were suspect due to either a cracked vial, or you'll recall back in the summer, or actually in the spring, there were vials of Pfizer that we were required to get 6 doses out of, but because of the needles that were provided, we could only get 5. That aggregates up to 500 doses that we were not able to administer. So about 1% was not able to be administered. That is significantly lower than the national trend and even the trend in our state. So, but in fairness, we wanted to offer that up to you as we've been transparent this entire time. On another note, you saw that the FDA has approved a Pfizer booster shot, or a third shot of Pfizer, to be administered for people who have received their full vaccination at least 6 months ago. The qualifications, as we understand them today, are that you be 65 years or older, or if you're 18 to 64 and immunocompromised, or if you're in that age range and you work in a high-risk facility. Now, that does not include J&J, it does not include Moderna, only for people who have received Pfizer. Now, Dr. Taylor and I both agree that more information is required before we can begin administering those boosters to people other than those immunocompromised. This is late breaking news. We have not received any further guidance from the state. We expect to get that in the coming days. As you know, we are prepared. The city of Memphis at the Pipkin location, Shelby County, and our partners at Southwest Tennessee Community College down in Whitehaven, and our partners at Germantown and Collierville out at Germantown Baptist, we are all prepared to begin giving those third shots as early as next month. And as you know, at Pipkin, we're doing that today for people who are immunocompromised. So if you'll bear with us, I know I've said it before, but more information will be coming. Now, we know that it is authorized for at least a subset of the population, so we'll begin administering those as soon as we have the guidance. Now, finally, we have done a lot of work to get the word out and to go door to door. Last week, we knocked on another 1,300 doors in the 38126 and 38118 zip codes, talking to individuals about vaccine hesitancy and offering them the opportunity to get a vaccine, including a ride to a vaccine. And for this week, we've already knocked on over 1,000 doors in the same zip codes, 38115 and 38118. And we continue to call people via our phone bank. Now we're up to 87,000 people we've called, and more than 50,000 people have engaged us in a dialogue. So again, our community is doing great work trying to get the word out. I encourage everybody who has not been vaccinated to come out and get your vaccination. And for people who are immunocompromised who would like that Pfizer booster, those are available to you. And finally, I would encourage everybody to continue to get tested, and do not delay testing if you feel at all that you are symptomatic. So with that, I will turn it over to Dr. Taylor for her comments.
Good afternoon, everyone. We're going to start with a series of slides today. Today, total number of cases in Shelby County, 139,496, with new reported cases of 423 and a 7-day rolling average of cases of 399. On the next slide, you'll see a 7-day rolling average of test positivity rate of 10.6%, meaning that 10.6% of the tests done in Shelby County over the last 7 days were positive. On the next slide, you'll see active COVID-19 cases by age, and you'll notice from last week that we continue to have decreases in active cases, meaning cases identified in the last 14 days, across all age groups except the 85 plus. On the next slide, you'll see a side-by-side view of the active cases by zip code on the left and the population vaccinated by zip code on the right. Please notice that on the left, the areas with darker colors are areas that have more active cases, and on the right, the areas with darker colors are areas that have more folks vaccinated. On the last slide, please note, as Chief McGowen indicated, that right now, as a percent of our population, about 51.4% of our population has received at least one dose, and right at 42.6% of our population has completed a full series, meaning that they have gotten 2 Moderna shots, 2 Pfizer shots, or 1 Johnson & Johnson shot. We continue to be cautiously optimistic as the number of new cases reported, and the 7-day average of cases per day has continued a downward trend over the past 2 weeks. The 7-day average test positivity has also trended downward from 12.8% last week to 10.6% this week. The reproductive rate of the virus, also called the RT number, is now down to 0.81. It was 0.92 this time last week and 1 2 weeks ago, and this means that the spread of the virus is slowing. Currently, there are 7 pediatric COVID-19 positive patients in the hospital, down almost 100 from last week. Down from 11 last week, excuse me. That is very encouraging news and an indication that masking in schools is working to protect vulnerable children who are too young to be vaccinated. These trends are encouraging, But to bring the pandemic to an end here in Shelby County, we must continue the course by continuing to mask in indoor settings, observing social distancing, and most of all, by getting vaccinated. About 10% of the COVID-19 cases identified since February are breakthrough cases, meaning cases among those who are fully vaccinated. But it's very important to emphasize that very few of those breakthrough cases caused illness serious enough to require hospitalization. But more importantly, we must continue to encourage the almost 50% of our population who have not yet received their first dose of vaccine. And with that, I will start off the questions.
Fred Broders, Local 24.
Good evening. Good afternoon, Dr. Taylor. First question, we kind of passed an unfortunate milestone overnight, crossing 2,000 deaths from COVID complications. Could you just talk a little bit about what this says about how real the risk remains, and just the thought that this latest 1,000, many of them probably were eligible to be vaccinated, and a follow-up.
Thank you for that question. As you know, and I've said this before, even one death in Shelby County is devastating. It means that a family is mourning. It means that a family has to deal with the idea that they will not have a family member at the table for the holidays. And so we mourn for all of the families, and we do mourn for this milestone. It is frustrating, to say the least, that we have reached this milestone knowing that a percentage of those who have passed away may have been able to be vaccinated, and it could have saved their life. And so that's why we continue to get out the message. We continue to vaccinate folks, not only at mass vaccination sites like the Pipkin, but all across the county. The vaccine is very readily available. It is free. It is safe. And anybody 12 and over is eligible to be vaccinated. And we pray that people will continue to hear that message and act upon it.
Thanks, Dr. Taylor. And as a follow-up, I know you're cautiously optimistic. There are certainly trends going in the right direction with reproductive rate, 7-day average, et cetera. Have you all given any thought? I know next week the next directive will be announced probably sometime mid next week. Any thoughts of easing anything, limiting mask potentially? Any general thoughts about where we are with the next directive?
So I think the important thing to remember is, yes, we are cautiously optimistic about the numbers decreasing, but we also understand from our institutional knowledge of this virus and the idea that viruses can still mutate, we have to remain vigilant about keeping mitigation efforts in place, and that includes keeping masking in place. The health directive will be renewed, and we will be looking at numbers to see if there can be any easing, but for right now, there are no plans to ease any of the current strategies that are in place.
Kelly Roberts, WMC.
Hey, good afternoon. I'm wondering, and I apologize if maybe I mentioned or missed it, but I just checked the Shelby County Health Department website and I didn't see updated numbers. Do we have the latest on hospitalizations? Are we seeing those kind of go down week over week as well?
Actually, we do. So the latest data available shows that 455 total COVID-19 positive patients are hospitalized, down almost 100 from last week, when 552 were hospitalized.
Thank you. And Chief McGowen, I know that at the beginning of this vaccine campaign, a lot of the questions from media were trying to get, what does our allocation look like this week compared to last week, and when will it ramp up, that sort of thing. Just listening to what happened to the 3,000 J&J doses and how you guys got those several months ago. I'm wondering if you could update us. What is the county seeing, or how are allocations basically working at this point? Are we still seeing thousands weekly, or is it kind of like a monthly thing. What are we seeing that may differ from kind of that hot peak at the beginning of the year when it was such an interest of people?
Yeah, that's a really good question, Kelly. And before I answer it, let me come back to something that Brad said about the cautious optimism that we have. I just want to pause for a minute and reflect on the fact that there are still 450 people in the hospital and more than 400 cases on an average basis per day. Recall at the beginning of the pandemic and even this summer, when we reached those numbers, we were worried because that is a huge number. Yes, it's down from the highs that we've had, but those are still huge numbers. If you talk to the folks in our hospitals, our ED docs and our critical care nurses, they will tell you almost 150 people in the ICU with COVID is 150 beds we don't have for other people. And so this is not the time. We are all, I think our level of tolerance of the numbers has been inflated because of the high numbers. But 400 people in the hospital is still an incredibly large number. I'm glad that we're down to single digits of children in the hospital, but one is too many. And so staying the course to get these numbers back down to a level that is more tolerable for our hospital systems to absorb, as Dr. Taylor said, no more deaths is what we seek. But to your question, Kelly, on the vaccine allocation, we get as much as we need when we want it. And so there is a request system. It has been fine-tuned over time. Both the private sector administrators of vaccines and the public sector are able to make a request through a system that the state has, and they ship that vaccine directly to us. Early on, as you know, there was scarcity and everybody was scrambling. And early on, we also had a huge uptick in demand that far outstripped our ability to get vaccine. That has completely upended now. We have plentiful vaccine and it's being provided just in time. The issue that occurred with the J&J, as I mentioned, was in April, we got 21,000 doses all at once, and hot on its heels was the pause by the CDC, which caused some distrust for a time, and we still have that lingering. And we have been working since then to find anyone who would take it because we did not have the local demand. But the short answer is we are getting just-in-time delivery of the vaccine to meet the demand that we see, and that's true not just for the public pods, but at the private locations as well.
Dominique Dillon, Fox 13.
Good afternoon. My question is about monoclonal antibody treatment. The state is recommending we prioritize people most likely to be hospitalized, get the treatment, including people who may not have been vaccinated. I wanted to know if the low supply is a concern in our county as well.
Well, I'm going to turn it to Dr. Taylor, but I do want to mention before she gives her medical, I'll talk logistics. We are blessed in our community that our hospital systems have been very aggressive in setting up the opportunity for people to receive monoclonal antibodies. All of our major hospital systems have those infusion centers, and we're blessed to have that, and they were early adopters. Our medical doctors, Dr. Jane and other infectious disease doctors were pushing that as a therapeutic treatment. So we were on the early end of that. I would hate personally to see any diminution of our access to monoclonal antibodies, but I'll let Dr. Taylor talk about the medical side of that.
Thanks, Chief. Medically, we're just happy that we have monoclonal antibodies as another tool in our toolkit to be able to treat folks, regardless of vaccination status. It's important that we continue to save the most lives in Shelby County, and monoclonal antibodies is just one of those ways that we're able to do that.
And as a follow-up question, is there a concern as far as having enough for people, or are you having to prioritize who receives it?
For right now, I have not received any reports of there being a concern that we would run out of monoclonal antibody here in Shelby County. Like Chief McGowen shared, our hospital system were early adopters of this therapy, and they even doubled down when they saw in the early numbers that we may be about to go through another surge. So at this point, I don't believe that's an issue for us here in Shelby County.
Jane Roberts, Daily Memphian.
I wonder if you could go over the information about the booster shot and the lack of data about who is eligible.
Thanks, Jane. So as you know, this was really late breaking news yesterday evening and today. And so literally we have not received further guidance unless it's dropped during this press conference to tell us exactly what that high risk group is going to look like, or who would be included, or what the verification process would be to verify that someone may be in that group. Just speaking from the standpoint of what the pandemic and operations of the pandemic look like right now, I don't believe we're going to have what we had at the beginning of the pandemic, where you have that tiered system, but I do believe they are going to be very specific about, we already know it's 65 plus, but they are going to be a bit specific about who's going to be in that high risk group, and we're just waiting, just like you are, on further guidance to know what that looks like.
So can anyone who's 65 or more go and get in line for a shot, or is there some stratification even above 65?
Great question. So for right now, what we know is that it is approved for folks who have a compromising condition to their immune system. So right now, it is approved for people with immunocompromised conditions, and they can show up, say that they have that condition, and receive their additional dose.
Catherine Burgess, Commercial Appeal.
I hope you guys are doing well today. My question is for Chief McGowen. Are unvaccinated Memphis Fire Department personnel giving vaccinations to people?
That's a good question. I do not believe that is the case. All of our folks who are involved in that are following every precaution. I don't know of any cases where our paramedics are doing that are unvaccinated, but it's possible for me to know everybody's individual status, but it's a good question. And let me come back to Jane's question about 65 and up. I would not, if you're 65 and up, get in line today to go get your third shot. We expect either later today or later this week to receive additional guidance from the state, but you can bet that we'll put that word out immediately on our website and through a release that says if you're 65 or up, when 65 and up can come out and get that.
That was my only question. Thank you.
Thank you.
Hannah Grabenstein, MLK 50.
Hi, good afternoon. My first question is a numbers question. I was looking at some data from last week, and I think, I could be wrong, but it looks like 200,000 tests were added between the 15th and the 16th, or right around then. And I'm wondering, is that number accurate? Is that an error? Were there actually 200,000 tests found and added?
Dr. Taylor can speak to that.
Great question, Hannah. So, no, that is not an error. What we found was that the state changed their way of reporting cases, and we also know because of the recent surge that we are hoping is coming down, continuing to come down, that there was a bit of a backlog at the state level in reporting those cases out. So because of that, and because of the way data is analyzed, we in Shelby County had to go through a data cleaning and adjustment period to make sure that we were continuing to report the numbers accurately. So that's that jump in cases that you're seeing.
Okay, thanks so much. And my second question is sort of a kind of a broad, wide-ranging question. I guess when you look at the efficacy of vaccines against severe disease and death, and you look at the efficacy of monoclonal antibodies against severe vaccine and death, or severe illness and death, and we have apparently like a sufficient supply of monoclonals. Obviously, we have a sufficient supply of vaccines, although we know there's hesitancy. And the monoclonal antibodies are for people who maybe aren't vaccinated or who are immunocompromised. I guess I'm trying to figure out, why are people still dying? Are people like turning away monoclonals if they're unvaccinated? Do people not know that there is this thing that's available to them if they if they get severely, if they're at risk of being severely sick. It just seems like we have so many tools in our tool belt. I don't understand.
Great question. I think that I would probably be a rich woman if I could completely answer it, but I will tell you that a lot of people are dying because the level of misinformation right now is at an all-time high. So you have some people getting misinformation about monoclonal antibodies. You have some people getting misinformation about vaccines. You have a lot of people getting misinformation about a combination of the two. So, and then of course you do have a segment of the population that just may not be aware of everything that's available. With that point made, we continue to bring the message to as many people as possible. You and your colleagues do the same. And so sometimes you have people die because even with all of those messages out there, accurate messages saying, hey, you can come get a vaccine and it can save your life. You can come get monoclonal antibody and it has the potential to save your life. Some folks just decide that they don't believe in any of it, and they make the calculated decision to take the risk not to reach into that toolbox and pull out something that could save their lives. I wish I could answer that question better, but that's as good as I can get today.
Can I offer something to you, Dr. Taylor?
Here comes Chief McGowen. He may have a better answer than me.
You asked a great question. We all scratch our head every day. And Dr. Taylor, if you just stand by, because I want you to verify something we've talked about. Now, with respect to the monoclonal antibodies, again, I'm not a medical expert, but as I understand from our medical doctors, they are efficacious early in the disease. So in other words, as soon as you're infected, within a few days of infection, that's when they're affected. When you come in and you're effectively have full-blown COVID symptoms, that's not as effective for you, and it's not even appropriate for them. Again, the medical doctors can verify that. But one of the things I talked about several weeks ago and continue to reiterate is for people not to delay seeking diagnosis that they are COVID positive, not to delay seeking medical care in an outpatient setting, either an urgent care clinic or at their primary care provider, so that the appropriate course of treatment can be provided before you require hospitalization, which may include monoclonal antibodies. So Dr. Taylor, would you like to comment, is that medically correct that early in the course, once you're positive, before you may be dramatically symptomatic, is the appropriate time?
Chief McGowan is exactly right. Now, with that said, we would prefer that folks come in early in the course. And if you saw a couple of weeks ago, we have a whole list of folks that we would like to come in, that if they are symptomatic and they're early, we want them to come in and get that treatment. That list included pregnant women, people with immunocompromised conditions. Doesn't mean that if you come in and you're severe, that the hospital isn't going to do and use everything they can to try to save your life. But those monoclonal antibodies work best, like Doug said, when you are early in the course. But what works even better is prevention. And that means that if you are eligible to be vaccinated, you should be vaccinated. Then you don't have to worry about coming in to get monoclonal antibodies, because you will be preventing getting COVID-19 in the first place. Now, there are some watching who say, yeah, but what about those breakthrough cases that you mentioned? Well, I'm here to tell you that the data bears this out. Over 85% of the people who have died from COVID-19, that 2,000 folks that we've lost in our community, over 85% of those folks were unvaccinated. There was less than 10% of the people who died of COVID-19 in our community who had breakthrough cases. So the numbers, as far as death and everything else that we've tried to tell you, they speak for themselves. Prevention is much better than trying to get treated on the back end, especially if you're unvaccinated.
We are out of time. Are there any closing messages?
Please If you have not been vaccinated and you are a part of that eligible population, please get vaccinated. That's everyone, 12 years of age and up. Now, Chief McGowen and I have both discussed this over and over again today, but we want everybody to understand that this couldn't be any more important than right now at this moment. Yes, the numbers are coming down, but we cannot stop working every single day to put efforts in place to save the most lives. Make sure you're wearing your mask in indoor public spaces and outdoors when you cannot safely socially distance, and please get vaccinated if you have not done so already.
Thanks, everyone. Have a great weekend, and we'll see you back here next week.